Treatment of choice for bladder stone is four options are A. Transurethral lithoplaxy, B. Percutaneous suprapubic lithoplaxy, vesicotomy and stone retrieval, intravenous antibiotics. Treatment of choice. Treatment of choice for bladder stone. A. Transurethral lithoplaxy. B. Percutaneous suprapubic lithoplaxy. C. Vesicotomy and stone retrieval. D. Intravenous antibiotics. The correct option here is transurethral lithoplaxy. What is the main hazard of ectopic testis? A. Impotence. B. Carcinoma development. C. Liable to injury. D. Hernia development. Well, it is liable to injury. Which of the following are the treatment option for cystosine? A. Anterior colporaphy. B. Transvaginal tape. C. Transobturator tape. D. All of them. Correct option here is all of them. Best time for surgery for hypospadiasis is at what age? A. 0 to 4 months. B. 4 to 6 months. C. 6 to 10 months. D. More than 2 years. It is 6 to 10 months. Operations for hypospadiasis are routinely performed when the patient is between 6 and 18 months of age. The infant has good tolerance to surgery and anesthesia by the age of 6 months. The child is well aware of his genitalia and toilet training by the age of 18 months. So the most suitable age for operation of hypospadiasis is between 6 and 18 months. Which enzyme is of diagnostic importance in chronic pancreatitis? A. Amylase. B. Pancreatic polypeptide. C. Lipase. D. Serum interleukin 6 levels. It is lipase. Elevated lipase levels. Elevated lipase levels are more specific to pancreas than elevated amylase levels. Lipase levels remain high for 12 days. In patients with chronic pancreatitis, usually caused by alcohol abuse, lipase levels may be elevated in the presence of normal serum amylase levels. Modified Koch-Whipple operation is devised to preserve which part of stomach? A. Fundus. B. Body. C. Lesser curvature. D. Pyloric antry. It is pyloric antry. Now, this procedure is also called pylorus preserving pancreaticoduodenectomy or PPPD or PPP Koch-Whipple procedure. It is a procedure of choice for most adenocarcinomas of head of pancreas. The original pancreaticoduodenectomy as proposed by Whipples include resection of gastric antrum. The Whipple procedure is now reserved for situations in which the entire duodenum has to be removed or where the tumor encroaches on the first part of duodenum or distal stomach, and a PPPD would not achieve a clear resection margin. Pseudocyst pancreas is developed in how much duration following an attack of acute pancreatitis? A. Less than 1 week. B. Less than 2 weeks. D. 3 or more weeks. D. 4 or more weeks. It is 4 or more weeks. True of umbilical hernia. A. Most common content is large intestine. Most of the umbilical hernias disappear spontaneously. Males are more affected than females. Uncomplicated hernias are repaired at 1 year of age through infraumbilical lesion. Correct answer here is most of the umbilical hernia disappear spontaneously. Treatment of congenital hydrocephalus is A. Ventriculoperitoneal shunt, B. Stereotactic radiosurgery, C. Diuretics, D. Radiotherapy. So the correct option here is ventriculoperitoneal shunt. How much percentage of blunt trauma injury to spleen in adults are currently managed non-operatively? A 30%, B 50%, C 80%, D 90%. Correct option here is 80%. Which of the following is false about Jenker's diverticulum? Most patients are above 50 years of age. It is the most common esophageal diverticulum. Mucosal outpatching through Killian's triangle. Cervical whips can be associated with Jenker's diverticulum in 80% of patients. Cervical webs can be associated with Jenker diverticulum in 80% of patients. This is false. Downhill esophagus varices develop as a result of obstruction seen in A. Portal vein, B. Hepatic vein, C. Superior vena cava, D. Inferior vena cava. Correct answer is superior vena cava. Pantaloon hernia is also called as A. Dual hernia, B. Saddleback hernia, C. Bochdalek hernia, D. Rectosternal hernia. It is saddleback hernia. Rolled up momentum is seen in cases of A. Peritoneal tuberculosis, B. Peritoneal metastasis, C. Perforation peritonitis, D. Malnutrition of gut. It is peritoneal tuberculosis. Treatment of choice for low fistula in ANA is A. Fistulotomy, B. Intravenous antibiotics, C. Staged surgical resection, D. None of the above. It is fistulotomy. Colonoscopy is not indicated in A. Meant to be, B. FAP, C. HNPCC, D. Corncoid Canada syndrome. Meant to be. Simplest investigation to be performed in suspected cases of gastric cancer is double contrast radiography, B. Plain radiography, C. CT scan, D. Endoscopy. It is CT scan. Plunging ranula is cystic growth of sublingual gland, B. Lymph node, a tumor in floor of mouth, D. None. Cystic growth of sublingual gland. Most common site of direct hernia is A. Hasselbalch triangle, B. Femoral gland, no site predilection, D. None. A. Hasselbalch triangle. Treatment of contaminated wound of leg is debridement and antibiotics, B. Hyperbaric oxygen, C. Amputation, D. None. Debridement and antibiotics. Most important diagnostic feature of congenital hypertrophic pyloric stenosis is A. Metabolic alkalosis, B. Non-bilious vomiting, C. Jaundice, D. Fever. Non-bilious vomiting. Gallstone impacted causing intestinal obstruction, A. Raynaud's pentamide, B. Hepatitis, C. Gallstone alias, D. Obstructive jaundice. It is gallstone alias. Hemorrhage after thyroidectomy is due to superior thyroidectomy. Anal fissure is diagnosed by A. Truss, B. Colonoscopy, C. Clinical examination, D. Barreling and colonoscopy. 70-year-old female with bleeding from proximal colon, CA colon.